Hi everyone, this is Dr. Keith Lewis. Thanks for watching this video. I'd like to continue our conversation today about testosterone, specifically low testosterone or low T. Of course, we've seen it everywhere. Commercials, internet, radio, TV, everywhere. Commercials everywhere about low T. And a lot of men feel like they have the symptoms of low T. And to reiterate what we've spoken previously about, no energy, no libido, erectile dysfunction, energy to the point where they cannot get off the couch, a couch potato syndrome. They've just lost themselves, losing their muscle mass, getting fat. But anyway, those are just a few symptoms of low T. And as we've talked before about, those are also the symptoms of estrogen dominance, which happens in men as well. Testosterone levels in men, before you undergo any type of therapy, number one, you need to have the testing done, the proper testing. Many of our patients come to us, they've had low testosterone diagnosed based on a test for testosterone, and in reality, exogenous or prescription testosterone really isn't what they needed for the treatment of their condition. They actually had estrogen dominance issues, or they had another hormone that was elevated causing the low T called DHT. Elevated levels of testosterone, as you may or may not know, contribute to prostate cancer, coronary artery disease, heart failure, kidney or renal failure. Not good things. High levels of DHT contribute to prostate cancer. And of course, high estrogen levels also contribute to cancer in males. So it's really important, before you just jump onto the bandwagon of taking prescription medication, is really you need to know, do you need testosterone in the first place? Or are you killing yourself doing that? Many of the men that we see, are on a hormonal honeymoon when they first start taking testosterone. They feel great. They feel virile again. They become an Italian stallion, as many people have told me. But the truth is, a lot of these people, after 1, 2, 3 weeks, maybe 3 months, that hormone honeymoon with the testosterone starts to go away, diminish, fade. They start getting all their symptoms back, maybe even worse. And a lot of these men are estrogen dominant because of an aromatase enzyme problem, or maybe their DHT levels are elevated because of a dehydrogenase enzyme dysregulation. And it's important to know this before you start any kind of testosterone therapy that could potentially kill you. So what we recommend for our patients, we recommend a hormonal panel that not only measures testosterone, it measures 14 different hormones that affect testosterone levels. With hormones, it's all about balance. Estrogen levels need to be balanced. Testosterone, DHT levels, androstenedione levels, even cortisol levels. The stress hormone has a direct effect on how your testosterone levels are. So it's important to measure all those hormones. We recommend a simple at-home, in the privacy of your own home, test kit. The test kit is pretty simple. It comes in a box. There are actually 4 vials that you actually collect these saliva samples. Yeah, just saliva and spit. It's really simple to do. You fill the saliva. We have you collect samples at 4 different times through the course of your day, because we're also measuring your cortisol levels at 4 different times through the course of the day. You collect the samples. The instructions are very, very simple to follow. Follow this simple guide. It tells you exactly what you need to do when you collect your samples. Put the information back in the test kit box. We also give you a UPS envelope that you can mail the testosterone test back to the laboratory. And when we get the results back, we'll not only give you the results of your hormone testing or your hormone screening, we'll also give you a summary report of where the imbalances lie, maybe give you some indicators as to what you can do to actually create better hormonal balance, if indeed you do have an imbalance. But anyway, don't start taking prescription testosterone unless you get all the testing done. A single testosterone test is not the best indicator as to whether or not you need replacement testosterone. So please, I'm begging you, do the right thing. Check 14 different hormones. Understand your hormone complexities and hormonal imbalances. And then do some things naturally. Then you're asking the proper question. You're asking the question why, not just treating a symptom. So again, the test kit, relatively inexpensive. Do it in the privacy of your own home. We can have the results back in less than 2 weeks. So again, if you'd like more information, please contact us at this site. Again, this is Dr. Keith Lewis. Yours in good health. Thanks.